If you're a caregiver for someone living with Alzheimer's or dementia, life was challenging enough before the coronavirus. Now, the crisis is making an already scary situation even more complicated. Joining us is Dr. Anafidelia Tavares, the Director of Programs at the New York City chapter of the Alzheimer's Association. And Dr. Tavares, are people with Alzheimer's or dementia any more susceptible to COVID-19?
We don't have evidence that they have an increased risk of COVID-19, but people with the dementia-related behaviors, their age, and chronic health conditions that go along with dementia put them at increased risk of serious complications when they get COVID-19.
Okay, now dementia or Alzheimer's patients often live in nursing homes so they can receive that around-the-clock care. But here in New York, 25% of all coronavirus deaths are residents of nursing homes. How should the increased danger be handled?
Well, so I think it's important that families reach out to facilities to find out what they're doing to protect staff and residents from coronavirus. It's also important for families to have a plan in advance for how they're going to get updates about their family members and their health situation. And if the person living with dementia isn't capable of speaking for themselves, how can families talk to a key staff person to get updates?
All right, and oftentimes the most heartbreaking thing about these diseases is that patients can forget or confuse loved ones. During the crisis, nursing homes are preventing visits to their facilities. So what should family members do since they can't see their loved ones face to face?
Well, so the reason that facilities are preventing visits is really to protect the residents. And so families in this situation should really ally with the facilities to make sure that they can get updates in terms of the care that is being provided. So they have a key contact person on the staff to get updates on their loved one's health and check in with video, phone, et cetera, so they really know how the person that they care about is doing during this crisis.
All right, and going back to the death rates at nursing homes, what would you say if somebody wanted to just bring their loved one home with them instead of keeping them in the nursing home?
Well, so that's a decision that has to be taken very carefully, weighing the risk of what are the protective mechanisms that are in place at the nursing home in comparison to what is the level of care that could be provided at home. Because mostly people are in nursing homes because they need round-the-clock care. So family members would really think through that carefully. We can help at the Alzheimer's Association families think through the pros and cons of that. We also know that many home care agencies are still providing care, but those has risks and benefits as well. So it's an important decision to consider, but people should be really informed in their choices as well.
And many patients in the early stages of Alzheimer's or dementia can stay at home until the diseases eventually progress. Now, we don't know how long this crisis will last. How do you think future treatments will be affected?
Well, it's not clear. We know that from the Alzheimer's Association perspective, we're continuing to do the work in terms of research and providing care and support to people with Alzheimer's disease. So that work will continue. In terms of coronavirus, all scientists and doctors across the country are working on coronaviruses as well. And we encourage people in this difficult time of caring for somebody with Alzheimer's during COVID-19 to reach out to us at the Alzheimer's Association. We have support available 24 hours a day, 7 days a week at our helpline at 1-800-292-3900. So we can be a resource to people in this difficult moment. We're making sure that the scientists and researchers are working on a cure for dementia. We know there's great work that's happening, but we're also here to support people as well during this time.
All right, Dr. Anafidelia Tavares, Director of Programs at the New York City chapter of the Alzheimer's Association. Thank you for joining us today.
Thank you for having me.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.